As India battles the oxygen crisis, the centre has stepped in to prevent states from hindering the movement of liquid medical oxygen to other states. The states have been directed to take steps for the revival of closed units to fast forward the supply to meet the increased demand. In a letter to the states, the Ministry of Home Affairs has also directed states to ensure uninterrupted supply and transport of oxygen. Not only this, the Home Ministry is also coordinating the lifting of high-capacity tankers from overseas, including Singapore and the UAE, by Indian Air Force transport planes. The Defence Ministry has sanctioned 5 crore rupees under emergency financial powers to the Armed Forces Medical Services to tackle the surge in COVID cases across the nation. The Armed Forces have joined the battle against COVID's second wave. From DRDO to the Indian Air Force, our brave soldiers have come to our rescue in times of need. Here's a look.
The armed forces have been roped in to fight the battle against the coronavirus pandemic. Giant C-17 Globemaster aircraft of the Indian Air Force are flying empty oxygen tankers to Panagar in Bengal and other locations for speedy refilling. Once filled, the tankers move by train to their destination for supply of oxygen to different states. The Indian Air Force has deployed C-17s and the heavy lift transport aircraft IL-76 for movement of oxygen tankers. Similarly, C-130J Hercules aircraft are being used for movement of men and material to the worst affected states. Doctors and medical teams from Visakhapatnam, Kochi, Mumbai and other locations are being moved to set up and man COVID care facilities in different parts of the country, including Delhi, Gujarat and Bihar. The Armed Forces Medical Services have also got the green light for emergency procurement of 23 mobile oxygen generators from Germany. These generators are being airlifted from Germany and will be deployed in different parts of the country at military hospitals. These plants have a capacity to generate 40 liters of oxygen per minute and can generate 2400 liters an hour. Each plant can cater to 20 to 25 patients a day and is expected to be operational within a week's time. The Armed Forces doctors and the Defence Research and Development Organization have set up a 900-bed hospital in Gujarat in collaboration with the Gujarat University. These COVID care facilities have ventilators and oxygen supply.
ગુજરાત સરકાર ડીઆરડીઓ અને સેન્ટ્રલ પેરામિલિટરી ફોર્સિસના ડૉક્ટરો આ ત્રણેય ભેગા થઈ લગભગ 950 બેડ, જેની અંદર 250 બેડ આઈસીયુ બેડ હશે, એ સુવિધા આવતીકાલથી અમદાવાદના શહેરીજનો માટે ખુલ્લી મુકાશે.
The DRDO and Armed Forces have already set up a 250-bed COVID care facility in the national capital near the airport and is being augmented for an additional 250 beds. Apart from Delhi and Gujarat, similar facilities are also coming up in Uttar Pradesh and Bihar. The Indian Air Force is also airlifting biosafety cabinets and autoclave machines to Leh to set up additional testing facilities. Top sources tell India Today that resources are being mobilized from across the country to chip in. But resources in Jammu and Kashmir and Ladakh are not being touched given the operational requirement. Bureau Report, India Today.
The monster COVID surge continues to haunt Delhi. The national capital has witnessed its highest single-day death toll with as many as 348 fresh deaths reported in 24 hours. Delhi reported 24,331 new cases. With this, the city's active caseload has crossed the 92,000 mark. Amidst the rising cases, Delhi's infection rate now stands at 32.43%. Meanwhile, a 500 oxygenated bed facility at Sardar Patel COVID Care Centre in South Delhi is likely to start tomorrow. This facility is going to be manned by ITBP doctors and paramedical staff. For days now, some of India's top hospitals and healthcare honchos have been sending out SOS on social media for oxygen. I'm going to repeat this. They've been sending out social media SOS tweets, and they've been taking to social media. Now, when a hospital does this, you have to understand the situation is grim. This means that the authorities somewhere are not listening to them. Scenes of distressed patients and helpless relatives begging for oxygen continue to haunt our country. India's oxygen levels are low at the moment. How long before things stabilize? Here's a look.
No space for them inside. A roofless, open-air yard turned into a makeshift hospital. Patients lying on stretchers, some hooked to drips. A heart-wrenching scene outside Delhi's GTB hospital, the largest state-run COVID facility in the national capital.
There is no medical attention provided to them. Even they are complaining that the oxygen is in short supply and most of them are serious, still not getting any oxygen support for them.
The insidious virus has overwhelmed hospitals across the country. There are not enough beds. There isn't enough oxygen for the influx of patients. Not just overcrowded government facilities, several private hospitals too issued SOS alerts when oxygen stocks became critically low. Replenishments trickled in after the distress calls. Haunting wails coming out of Lucknow. No oxygen for stricken patients. A hospital buckled under pressure, urging sufferers to go elsewhere.
स्टेट लेवल पे गवर्नमेंट हर हॉस्पिटल की यही बद कंडीशन है कि ऑक्सीजन नहीं है। कितना हम फॉल्ट बनाए इन लोगों का, आप ये बताइए। ये भी तो अपनी जान के ऊपर खेल के पेशेंट्स को देख ही रहे हैं ना।
Authorities, however, downplay the ongoing crisis.
ऐसी कोई स्थिति नहीं है कि हम लोग हॉस्पिटल को ऑक्सीजन दे नहीं पाए। पहले चाहिए कि पैनिक बिल्कुल ना हो। जो व्यक्ति इस हॉस्पिटल में या सभी कोविड हॉस्पिटल में जो भर्ती है, सभी के लिए पर्याप्त ऑक्सीजन हमारे पास है।
कई उल्टा भेज दिया, कई हॉस्पिटल हम सुबह से हॉस्पिटल का चक्कर काट रहे हैं, भर्ती कोई नहीं कर रहे।
Panting in an auto rickshaw.
भर्ती कोई नहीं कर रहे।
Desperate pleas for oxygen at a medical facility in Meerut.
ये तुम्हारे भाई है ना यहाँ पे? अभी क्या हुआ था यहाँ पे?
Certainly, the condition in Uttar Pradesh capital Lucknow is getting worse day by day. But the shortage of oxygen has become a severe concern, not only for the government, for all these patients and the hospital members who are coming here in order to get this basic oxygen supply.
In Punjab, this hospital in Moga is also battling oxygen shortfalls. Authorities in Jharkhand say they have adequate stocks. But oxygen suppliers insist they are bursting out at seams to meet the rising demands.
ऑक्सीजन को लेकर तो सर मारामारी तो है ही लोगों के बीच में, और हम लोग सिलेंडर रिफिलिंग का काम करते हैं, तो जो सिलेंडर रिफिलिंग के लिए आता है उसको भरा के हम लोग उनको सप्लाई कर देते हैं।
Maharashtra confronted yet another tragedy in 2 days. On Friday, a fire claimed lives of at least 13 COVID patients at a hospital in Virar. This after 22 patients died at Nashik when they lost their oxygen supplies because of a leak. With the highest caseload, the state continues to walk the razor's edge.
ऑक्सीजन की कमी ज़रूर है। प्राइम मिनिस्टर ने भी एक चीज़ पे बहुत जोर दिया है कि वेस्टेज न हो, लीकेजेस न हो। जो बचत कर सकते हैं वो करना चाहिए। लीकेजेस अगर रोक सकते हैं, लीकेज रोकना चाहिए। इस तरह से मुझे लगता है हमने एक स्ट्रैटेजी बनाने की ज़रूरत है।
The central government is scrambling to shore up supplies by rail, road and air. A momentous challenge to deliver them to every grasping patient before more lives are lost for want of air. Bureau Report, India Today.
India's battle against coronavirus could get a lot more grim before it gets better. A study by University of Washington has projected that India could witness 5,600 deaths per day by mid-May, and close to 3 lakh people may lose their lives between April and August alone. The study, titled COVID-19 Projections by University's Institute for Health and Metrics and Evaluation, also projects that the total deaths in India and the total toll may rise up to 6,65,000 by the end of July. But there could be some hope. The study also states that universal masking can help India limit that death toll by 70,000. Expanding the vaccination program is also going to be helping saving lives to the tune of 85,600. With the virus mutating and spreading much faster this time compared to the first wave, scientists have predicted that the ongoing second wave of COVID pandemic across the country could peak by mid-May. Listen in.
The second coronavirus wave has got a vice-like grip on India. The virus has become more contagious and is spreading like wildfire across the country. The one question we're all asking is, when will this end? More importantly, when will we see the peak of this current wave? The reproduction metric in India, which shows you how fast the virus is spreading in the current second wave, paints a very grim picture. And if the current spread is anything to go by, the COVID curve isn't flattening anytime soon. Experts say that the current COVID spike will continue for another 2 to 3 weeks. It's estimated that cases will peak by mid-May and then will gradually come down.
I think we need more data to really come up with accurate projections, but right now, the early part of May is when Maharashtra is showing to be peaking in many of these models, and then India, depending on what happens in other states.
The biggest worry of this second COVID surge is the virus variants that are spreading. The virus has mutated fast in India, and we're still learning about so many variants that have emerged. Take, for example, the scary Vidarbha variant in Maharashtra. The new strain, which was first seen in Amravati district, has spread to Nagpur, and cases have surged since in the district. It's more contagious, but fortunately less lethal than the current strains already present in India.
एक आदमी को इन्फेक्शन हुआ और कुछ कारण से लोगों ने ज़्यादा पसंद किया होम क्वारंटाइन, और पूरी की पूरी फैमिली इन्फेक्ट हो गई. कई सारे मरीज ऐसे थे कि एक फैमिली से 5-5, 6-6 मरीज आते थे, जिसमें कुछ लोग तो घर में अच्छे हुए, कुछ लोगों को एडमिशन लगी, जिसमें काफ़ी सारा एक यंग क्लास भी था जिनको शुरू में लगा कि उनको कुछ होने वाला नहीं है, लेकिन बाद में पता चला कि अभी सीरियस कंडीशन है, तो भागते भागते हॉस्पिटल घूमते थे.
The second coronavirus wave has shown us that we still have a lot to learn about this virus, as new variants have made it difficult for authorities to treat and track cases in the country. Bureau Report, India Today.
As India battles monster COVID surge, our doctors continue to inspire us with their selfless service. Take a look at this report.
Undeniable gloom due to coronavirus pandemic in the country. Amid this avalanche of bad news, there are some brave hearts who are at the forefront of COVID fight. Meet Pragya Ghade. She is a doctor by profession. Pragya works at a COVID center in Nagpur, but was back home for a short vacation in Balaghat, Madhya Pradesh. Sudden spurt in Maharashtra's COVID cases pricked Pragya's conscience. Transportation to Maharashtra was hardly available, but that did not stop Pragya. She decided to drive 180 kilometers to Nagpur. That's right, a long, arduous drive in the face of supreme duty to COVID patients.
मैं पहले भी कोरोना
बीमारी में काम कर रही थी, पर लॉकडाउन के कारण मैं घर चली गई थी और कोरोना के बहुत सारे केसेस बढ़ने लगे थे, तो मुझे हॉस्पिटल से कॉल्स आ रहे थे बहुत सारे, और उस टाइम मेरे पास साधन भी नहीं था, तो मैं स्कूटी से नागपुर आई। मैं 9 बजे बालाघाट से निकली, तो मैं 3 बजे वहाँ पहुँची। मेरा उद्देश्य था कि मेरी पढ़ाई मेरे जीवन में काम आए।
Pragya's patients are worried but equally proud.
लॉकडाउन के दौरान उन्होंने मुझसे चर्चा किया कि मैं नागपुर जॉब करने जा रही हूँ। मैंने उन्हें रोका क्योंकि मैंने बोला बेटा लॉकडाउन है, जाने की समस्या है, लेकिन वो स्वयं तैयार हुई। अपना बैग स्कूटी में स्वयं पीठ पर लाद करके स्कूटी से 9:30 बजे यहाँ से निकली और नागपुर वो 3:30 बजे पहुँची। नागपुर पहुँचकर उन्होंने तुरंत ही हॉस्पिटल ज्वाइन किया और आज वो कोविड सेंटर में मरीजों की सेवा कर रही है। मुझे उस पर गर्व है।
If Pragya is a real life idol, then these doctors and health workers from Surat are equally our heroes. These hospital staffers celebrated birthday of a COVID patient in Surat.
Happy birthday to Hinabim. Happy birthday to you.
The depression of pandemic has not allowed our COVID warriors to lose hope. Their actions is a timely reminder that not all is lost. Bureau Report, India Today.
Punjab Kings have finally registered victory after 3 defeats in a row. Mumbai Indians could manage just 131 for 6, their lowest score this season, before Punjab got over the line with 9 wickets in hand. Take a look.
That's why I wasn't in.
Get in, oh, that should be out. Comfortable catch to Moises Enriquez.
Mumbai Indians just did not get the start they were looking for, losing Quinton de Kock early once again.
On the surface here, but that's a freebie.
Rohit Sharma batted with patience but also took his opportunities to hit boundaries.
Only so far. Hello. Another unacademy crack.
After de Kock and Ishan Kishan, Surya Kumar Yadav gave good company to Rohit and they together got 79 runs.
Tough to hit. Now, a little bit too much width again.
Rohit Sharma got his half century. But still, Mumbai seemed far from a score that they had thought of.
And he was just waiting for it. That swung away, but that goes to Fabian Allen.
Once Rohit Sharma was dismissed for 63.
After hitting it, Rohit Sharma.
Mumbai Indians struggled to reach to 131 for 6. Their lowest score this season in 5 matches so far.
Brilliant catch from Nicholas Puran. And he's so good, Mayank Agarwal. You can
In reply, Punjab began well and scored 45 for no loss in the power play.
Oh, 2 poor deliveries back to back, and this has been...
Once Mayank Agarwal was dismissed, KL Rahul also slowed down.
Yeah, that's gone fine.
Chris Gayle, however, was there and selectively hit boundaries to keep Punjab Kings ahead of the curve.
Uh-oh. Oh, he's got away with it. What a way to bring up.
KL Rahul got to his half century, his slowest in the IPL.
That's better. That's what he's looking for, the Yorker.
But he hung around to ensure that Punjab gets over the line and earn those 2 valuable points.
79 from 65. Rahul not out 60, Gale not out 43.
Sports Bureau, India Today.
Chase here by these two.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.